Hey everybody, pretty excited about today. Yesterday, I got to film a new episode of Dr. Phil's show. That was awesome, and some of you may have seen these cold plunges I'm doing. My brain is still getting used to that. I was going to talk to Dr. Shafali today, but I got the date wrong. So instead, we're going to talk about change your brain every day, 366 short essays on the most important things I've ever said. And today, we're going to talk about day 144, 9, surprising early warning signs of dementia. I'm going to turn 69 in a couple of months, and I've seen way too many 69-year-old brains to not be concerned. And so, how would you know whether or not your brain is headed for trouble? At Amen Clinics, we look at the brain. So, I can tell decades before your brain is troubled if it's headed that way. But let's talk about it. Alzheimer's disease and other forms of dementia happen early. They're negative changes in your brain, even some studies have shown in your teens. So when should you be on a prevention program? As soon as you care about your brain, no matter what your age. So, surprising warning signs. You break the law. Law-abiding citizens who suddenly start doing things out of character, you should be concerned. Eating weird stuff, changes in appetite, and the foods you crave, if it changes big time, can be a sign of early dementia. Falling more frequently. And when I had Aslan, our white shepherd, who I miss every day, he was always leaving toys around to trip me. And I'm like, dude, who's going to feed you if I die? Very important to pick up things so you don't trip. And very important not to text while you're walking and while you're driving. And these phones, they have that dopamine attachment. Oh, I need to know what's that text, or what's that email, or what's that notification. Don't do it when you're walking, when you're driving. Gum disease. If you have gum disease, odds are you have an increased risk of heart disease and brain disease. Floss. See your dentist. Get serious about taking care of your gums. It's absolutely critical to the health of your brain. Inability to pick up on sarcasm. Now, if you talk to my family, they think I'm pretty funny and often sarcastic. If they're not picking up, either I suck or something's going on in their brain. Engaging in compulsive behaviors. If you hadn't, and that's not been your story, but all of a sudden you start collecting things, or you have to do things a certain way, you get upset, it could be a sign your brain is deteriorating. Your sense of smell is off. In fact, a smell test is one of the early tests for dementia. So working out your olfactory nerve, working out your sense of smell, really important. Depression, is often a prodrome of dementia. In fact, if women have problems with depression, it doubles their risk of Alzheimer's disease. If men have depression, it increases Alzheimer's fourfold. And lastly, if you have untreated ADD, the show I did yesterday with Dr. Phil was on attention deficit disorder and the overprescription, but also the underprescription of medication for children and adults with ADD. It's a fascinating show. But if you have untreated ADD, you're more likely to get dementia because it increases other risk factors such as head injuries, alcoholism, obesity, sleep problems, and so on. So, day 144, change your brain every day. It's out in about 6 weeks. I'm so excited. And if you pre-order the book now, Amazon, Barnes & Noble, Target, Walmart, wherever, go to Change Your Brain Every Day. And we have 4 free gifts, including a bottle of Calm My Brain. So, love your brain so you don't get dementia.